Great.
I think
have the
all the
message.
audiences, I think all the audiences are still from Indonesia, right? Masih dari Indonesia semua kan ya ini pesertanya ya?
There is one
Ada.
from Africa, I think.
Oh yeah. Who is
Yes.
that?
Yes, MCAP student.
Moses,
Almost
Moses.
has.
Yeah.
Okay, yeah. So
and maybe
then,
Francois.
oh yeah. Welcome, Moses, from Africa. Which part of Africa are you come from?
I'm from Liberia.
Oh, Liberia. Okay. Okay, then now I'm going to speak English. Okay. Hello, everyone. I hope you have a great day so far. So it is an honor to meet you this afternoon. So this afternoon we're gonna discuss about global health nursing. And then here I'm a country. Some of you might already know me. So I'm a lecturer in School of Nursing, and then I'm in a community nursing department. And today I will act as the moderator of the discussion. So as you know from the flyer, today we have two distinguished speakers. Yeah, first we're gonna listen the lecture or the speech and presentation from Budianita Sugio, and then second we're gonna have a guest lecture from far away from the University of Edinburgh. So we don't read it Edinburgh, yeah. If you see it's like the University of Edinburgh, but actually it's Edinburgh. I think in Scotland we say Edinburgh. And she's Dr. Fiona Katil. She's actually one of my principal's supervisors during my PhD study in University of Edinburgh. Okay, so what we're gonna discuss today is about global health nursing. As you know, like nurses is the largest part of the global health workforce. Yeah, a world without nurses is like impossible to imagine. Everywhere you turn there is nurses, and now especially with the condition with the COVID-19 pandemic, even like the role of nurses become like really important. If there is no nurses in this situation, you can imagine it's going to be really chaotic. So yeah, we should already know and understand what can nurses do as well in this kind of situation in facing the threat of the global public health now, and then what we are going to face, and then also what are the other roles, because as a nurses we are not only focused in providing care for the people who are sick in the hospital, but also for the people still healthy in the community. We can also help them to improve their health by by the health promotion effort, prevention, and also rehabilitation. So yeah, we're gonna discuss about that today from our two speakers, and hopefully that you all can gain and learn some knowledge from today's discussion. So I think without further ado, we're gonna start from our first speaker. So here we have Budianita Sugio. Welcome, Budianita.
Hello, Ibu Tantri. Welcome as well to you. Just
Yeah.
in my side.
Yeah, thank you for spending time with us this afternoon to
Sure.
have that discussion. I think it's more relaxed
Yeah.
discussion with the student of the nursing postgraduate nursing study. So I'm gonna introduce Budianita a bit. So Budianita is one of the nurses in the School of Nursing as well, and she earned her master degree in Master of Health and International Development in Flinders University, Adelaide in 2011. And actually, Budianita is going to go to Germany soon for her PhD study. So best of luck with your PhD study as well, Budianita. So I think we only have 20 minutes before we wanna start the meeting. So for the time is yours, Budianita, to provide your presentation.
Okay, thank you, Bu Tantri. Before we going to the second speaker, Fiona. Fiona will be attend at 3, and I will giving a glance first about global health and also how nurses can participate into health public policies. Can everyone see our screen yet? Okay.
Yes, perfect.
Yes.
Yes. Yeah. So this is actually the same quite close to what we are doing every day, especially as community nursing or public health nurses. This this is nurses and public health policies that I thought that that everyone have to understand and have to be ready for that. I think I cannot. Wait a minute. I cannot move my PowerPoint, I think. Sorry. I'll just exit the slideshow.
Should we?
I think I cannot move to the next slide. Or can you
Okay.
put from there, Pak Saru, for me?
Yeah, okay.
Okay,
We'll
okay.
try, Bu
Yeah.
Dianita. Okay, yes.
Okay, thank you. Sudah dicatat. Oh, well, waiting for the share screen from Pak Saru, I will start with what is actually global health. I think most of you have familiarly heard this term and also maybe using in your manuscript or in your daily conversations when community nursing is a theme. So actually the global health require a global cooperations in response, planning, preventions, and also preparedness and care to achieve equity issues among nations. So in the context of global health, we not only talking in the local issue, but also what is the global issue currently. And I think you also aware on the global issues recently that we have a big pandemic, long pandemic, almost 1 year we're struggling with the COVID-19. And it is also one of the concern of global health is as well. Okay, share screen start. Okay, I think everyone's already gets into the screens. And in global health itself, it's actually require complex interprofessional and also workings. It's agency, one by one agency working together in cooperations and giving solutions toward the health problems. The complex interprofessional not only necessarily to only involve the health workers, for example, doctors, nurses, pharmacists, dentists, but also require an interprofessional working within the government and non-profit organizations, and also the private companies and foundations. These private companies, as one of the part of the community, will taking important roles on driving their portions on the developments in global health. Next, Pak Saru. Okay. Now we're talking on public health issues role. So what is actually, especially for community nursing or public health nurse, having the role? I think you always familiar and often writing on your argument when you are asked about what is nursing role itself. Advocacy, I think, will always you mentions in one of nurse role. And this is I will talking as well about advocate for how we could advocate for health policy in nursing. So the first is about responsibilities to eliminate health inequalities and achieve equity. As we know that Indonesians in our reciprocal countries, the inequalities to access health services become also the issues of how the community can achieve their health and also how they even funded their health itself. Even some of them may be not getting access of information how to achieve the national health coverage or BPJS. The second is recognize and understand the impact of social determinant of health. It is all the social related issues that have shaped how health itself be achieved by people. For example, on how people are getting the revenue or getting their salary and its impacts on how to purchase their health supplies and possibilities to access the health services. The third thing that is very important in nurses' role of public health nursing is advocate for justice and equality. This is not only giving information or you advocate people so that they increase their literacy, but also how you will be partner with the legislators and also the interprofessional leaders. For example, the mayors, the regions, the people's representative, both in local and also national, and then implement in addressing local, national, and global health issue. This point needs a very high commitment on how you will possibly build a network, not only within the health services or healthy or health working people, but also people beyond this professional. So interprofessional will be a key on how you can build your issue and also your point to be raise awareness among the public. Next, Pak Tahru. Okay. Next, it will be more focused on nurse advocacy to adopt a health in all policies approach. That the policy advocacies, it require a big resource that it will be help how nurses and also people related to that to helping shaping the populations of health within the community. How the ability of nurses of knowing and also awareing the kind of public policy that might be misused in the community or not addressed well, or for their implementations they might be not bending the law. So the nurses have to analyze what is actually the legal concerns in its policy implied in the community. And the second thing is we need to identify what is the right public health policies. The right public health policies mean how the policy itself can cover the public's or the community needs and can therefore giving the protections to the community and also the people globally. So within right public health policies, it is needed that it will be in returns in the futures. It could interrupt the cycle of poverty and also people disadvantaged and the poor health by addressing the social determinant of health itself. Next. Okay, this is the key social domains with improvements when you are considering the right social policies. The key social domain are child and youth education and development. The second is fire, employment and decent work. The third is social protection, following by the living environment or where we living. Next. Okay. In this table, I will explain more in detail on how social determinant of health will delivering a potential impact and also a significant effect on how the policies and also nurse advocacy are just picking one of the key domains from the previous point. It is the youth development. At the first, we need to define what itself, the point itself, the definitions of youth development, that everything, the process or the development that related into young persons, how that they could achieve the health standard and then could maintain their health, and for further, they can participate into the national development or country development. The second row, why you need a consent into youth development, or the rationale or the reasons why you should bring the issues into your advocacy policies, because this will be taking more crucial analysis and also reasons when you argue with all the legislative and also people representative force, for example, on how the program itself could demonstrate or bringing the positive impact on the youth and also their parents, for example, so that they can lead and motivate into a good health and social behavior. The third thing that we need is evidence-based program policies. This could be a wide range programs that you could develop, but when you rely on evidence-based program or best experience to be shared, and then you can match with what is the actual problem or what is the current data that you face in the community, so that you bring a program itself. For example, in the evidence-based programs for the youth development, here I put educational development opportunities for youth, and then school community partnership or the school initiative that maybe we also familiar in Indonesia as UKS, and also the school-based centers for disadvantaged people, for people that may be very difficult to access the urban area where the school are provided, for example, and also one of the case that I will be extend is the addiction prevention program. So the nurse advocacy's opportunity in this youth development of the mentioned evidence-based program are to support policies and legislations that in futures will advance the youth development and also the opportunity of youth in participating in the global development. Next. This is, we're going to more focus on nurse and social policy advocacy. I picked a sample here. This is a partnership perspective in tobacco control. We need some planning on approaching partnerships and also policy advocacy in tobacco control. The first thing is identify social needs. So what is actually problem in your community? How the problem itself impact into the development of the children, and also because the children is the future nations. So you need to make sure what is the further problems will be affected the nations. To identify the social needs, it could be through and focus group discussions with the people representative itself, or with the youth representative, or with the people's or parents organizations that will be extend the problems that they face in raising children. The second things that also needed in identify social needs is through a survey or public poll. So for example, if you want to advocate on how the smoke-free policy be implied on a region or in a province. So before going to meet the people representatives, you will need a people survey. How is actually people concerns on smoke-free environment? You can set a survey with the tools that will be able to collect all the opinion from the public on how they need the smoke-free regulations. The second thing is analyze current related local policies. It will be a resource for you to support your argument when you approach people representative or local governments, or for example, in the national or global context, to which organizations or body or party that related to the policies. You will need to push this. For example, in global context, you might need to advocate and meet with the WHO or the organizations that having concerns into the future health of the children. The third thing is health in all policies approach. We have to very taking in mind that influencing people from different perspectives within our perspective will be a key on how your words will be heard by them. So for example, in a smoke-free policy advocacy, we will working with the Women and Child Protection Department, with the People's Health Departments, with the legal perspective, for example, from the people representative or DPR, with the disability policies, and also maybe tourism and cultures, local policies, because smoke-free itself need an environment approach on how people could maintain their cultures, their environments, and it will be having a correlations with, for example, tourism and cultures, local government. The next things that you need after doing range of focus group discussions, surveys, analysis, health in all policy approach is mapping the key actors in advocacy. Who is your allies? Who is your partners? And who are your opponents? You have to collect all the information that it will be ensured that our partners or our allies will be supporting us to sound our policy or things to advocate. Next. Okay. This is a more focus on a comprehensive approach in health in all policies approach. The first thing is to integrate social determinant of health itself into the public policies. how people finding difficulties in accessing informations on the dangers of tobacco or smokers, or how you can identify the massive of advertisement, promotions, and also sponsorship from tobacco industries, or how they lead their marketing management into releasing the new electronic tobacco. For example, IQOS in Indonesia, it will be a new challenge into policy advocacy. The second thing is incorporate health considerations into the policy to making it process. For example, if you want to advocate on smoke-free policy regulations, then make sure what is actually the prevalence of smoking if we have models for current years, and what will happen in the next 5 years if all the advertisements still bombarding you in every corner of the cities. The next is multi-sectoral collaborations across sectors and policy areas in government, and that the health in policies approach also make sure that it involves the women and child protections, what is the legal perspectives of them, and also with all the policies or policymakers that's potential to working with. Next. This is how the criteria of the effective health policy advocacy will be measured. Once become it's familiar with your organizations, and also strategic plan focus on health disparities, make sure that you will bring these issues into your advocacy policy, how your organization concern on people's health, on the health of the children, and seeks allies or appointments to non-nursing boards. For example, you might working with the people from the tourism sectors or from the culinary sectors. What will be all the restaurant managers could be support you to implement a high standard on smoke-free policy. The next is to establish a research agenda around social determinant of health. So try the community to involve them and giving them possibility to sound their aspirations on how actually people require a smoke-free, and rather than they are actually needed as well a fresh air, but they cannot sound or deliver to the policymaker. So this is our plan, or this is our path on how to advocate them. And work with professional and specialty nursing organizations on how you on how you can interact or can insert the policy advocacy with a perspective of health in a public policy agenda. Could be included in drafting position paper or drafting an academic paper that needed to giving a reason on how a smoke-free bill have to be enacted. Writing legislative officials, and also you might join as well with the people in the representatives that having the same views and also having the same concern on the smoke-free, so that they can be giving a response or also input on how a public policy should be driven. Next. This is the practical ways on how actually the policy and also its advocacy can be successful. The first is learn how policy itself develops. the policy require or already involve the people in developing this, or it is actually already based on the evidence base from the survey that also hearing for the people voices on what is actually people's needs toward the smoke-free area. The second is learn who is participating in a policy development and make contact with them. Make sure that you have all the information, even how the tobacco industry, for example, could interfere with our government. How the, for example, how the advertisement will be placed freely in your country or in your city, even if you already have a smoke-free legislation. And try to explore resources related to policy formulations on how each of the policy regulation related to each other, both in the national and also in the subnational level. Make them in correlations and make them as your support when you talking or meeting with the peoples in the representative assembly. And the next thing is prepare for a vaccine or kind of survey or the database or the informations that you could fill the people in the representative so that they can make sure what is actually needed to be doing, to be taken to protect the youth and also the community from the dangers of the smoking. And seek information as well for judicial review, for policy advocacy. If a policy you think based on your group analysis is not well developed or it can't be aspired, how the people can participate into the policy implementations. Next. Okay, this is some of the snapshots from the nurses in policy advocacy. In the first pictures, it is how nurse could engage into policy advocacy. This one is the meeting with the official office of the Presidential of Indonesia or Kantor Staf Presiden on how the nurse could push the taxations on tobacco products in Indonesia. The second pictures is the people from the Ministry of Health, from the Central Board of Muhammadiyah, and also the rectors of UMY. This is the ceremony of smoke-free campus in Universitas Muhammadiyah Yogyakarta that involves all the people from the national and subnational level to bring this policy to all Muhammadiyah universities in Indonesia. Next. Okay, the first pictures is Ibu Tantri. When once presenting in people's representative in Bantul districts on how to make them sure that the smoke-free policy will not reducing their local revenue, rather than it's actually raising the local revenue based on the experiences from the two other districts. And the latest pictures is, this is a group of nursing task force as well. Ibu Resti from School of Nursing of University of Muhammadiyah, Ibu Resti, and also Nisa. So we are working with the regions of Sragen to implement a smoke-free policies in Sragen. Okay, Bu Tantri, I think that's enough for me. Fiona is already in the meeting, I think. Thank you.
Thank you very much, Bu Dionita, for really insightful presentation about how nurses can contribute to shape the policy in healthcare sector. So here we already have Fiona. Welcome, Fiona, to our school. Welcome back to Indonesia. It's second time also, now it's virtually.
Yes, thank you. I've had a lovely visit to Indonesia in real life. So it's not nearly as exciting to come virtually, but it's lovely to be with you all and my greetings from Edinburgh in Scotland.
Yeah, it's really, we are really delighted to have you here. Indonesia also virtually, but hopefully next year or maybe when all the corona things are already like settled down, and then you can visit us for real here in Indonesia. And actually here we also have some participants from Malaysia and from Africa, and also from some of the alumni of University of Edinburgh. We have Kurnia, we have May Indah, we have Mita, I think. So yeah, all the alumni wants really happy to see you here.
Oh, lovely. It's nice to see some familiar faces.
Yeah, okay. So we already have the first speaker presenting about the nurses and health advocacy. We are going to continue for your presentation, and it's about like global health nursing and how the role of nurses in shaping or can contribute in this area. But before you start, I would like to introduce Fiona to all of the participants. And yeah, I'm so happy Fiona was my principal supervisor during my PhD studies. So I had a really lovely and really, like really enjoyable time in Edinburgh for the last 4 years. Thank you for Fiona for that. And she's the senior lecturer in the University of Edinburgh. And also Fiona is the academic director for the Center for Homeless and Inclusion of Health in School of Health and Social Sciences in Edinburgh, and also the program director for the MSc Advanced Nursing Practice. So if anyone from here in the participants wants to continue the study, even it's master or in PhD in Edinburgh, yeah, Fiona can be one of the supervisor, and she's really wonderful as supervisor. So Fiona, like the interest, like the interest, research interest and stuff, it's about the global public health and also the community health and also the homelessness and health and also refugee and health promotion. So I think without further ado, Fiona, time is yours to present your presentation.
Thank you very much. Okay, can I just check that you can see my screen and you can hear me?
Yes, yeah, that's perfect.
Okay, lovely. Well, my greetings from Edinburgh in Scotland. It is lovely to meet with you and to meet Sutantri again. It was fantastic to have her in Edinburgh, both for the Masters and her PhD. And it's my privilege to come back and to meet with you all this morning, very early for me, but I understand in the afternoon for you. So I'm going to talk today about global public health and nursing in a global context, and really that big picture, that global picture of what we can do as nurses and how we can really impact on global public health. So this is more of a big overview of the topic rather than specifics, but really to focus on nursing, and at the end of this presentation really to think about nursing and how important, particularly in the last 2 years and this last year with the COVID epidemic, that the spotlight has really been placed on nurses and nursing as a profession and how we can really capitalize on that. So just a very quick overview. Edinburgh is way up here in the north of the UK on the edge of Europe. We have a very old and historic castle, and the sun doesn't shine all the time, but I put a picture on with a nice blue sky. Edinburgh University is a very old and historic university. We're one of the oldest in the world. We rank about number 20 in the University World Rankings, and we're a research intensive university. So we welcome anybody who would like to further their research and further their research around nursing studies. And I've worked with many different students from around the world. And just amazing nurses who are pushing forward with research and nursing research. And that's one of the best parts of my job. This is a picture of Edinburgh looking particularly beautiful at Christmas. And Scotland is famous for these men who wear kilts, skirts and tartan. Each group, each family group has a different coloured tartan. So that's the small, quick tourist introduction to Edinburgh. As Sutantri has already introduced, I work in the School of Health and Social Science, and that is really quite unique that as nursing, we are situated with a School of Health and Social Science, not in the medical school. So nursing is an independent department. We're in a department of social science, so a lot of what we look at is particularly social theory and how that applies to nursing. And that makes it for really fascinating research, but also gives nursing as a profession an independence in terms of professional identity and professional research, which we're really proud of. Oops. We have an undergraduate programme, which are generally young nurses who do a 4-year undergraduate programme to have a bachelor in nursing. And I am the director for our master's programme in advanced nursing. And we have students from all around the world. This is our group from a few years ago, from Saudi Arabia and Ghana and Taiwan and Canada and the United States, from India. We have a real international programme, and it is a real privilege to welcome students from around the world to Edinburgh to study our masters. So today I'm just going to talk a little bit about the role of nurses in global public health, to think about global health, what that means, globalisation, public health and how we situate that within a global context, and understand the global threats to health and the role of the nurse. And one of the big and very exciting things that is happening globally in terms of nurses and in terms of nursing us as a profession is the huge traction and increase that we've seen in the last 2 or 3 years of the role of the nurse and what that means as a profession, and that recognition that we are being recognised as a real critical profession globally, and particularly in terms of public health. And I find that very exciting to be part of. So key question is really, what does global public health mean to you? I think for many people, global public health, there wasn't really that much understanding. As nurses, we can tend to work very much in an individual way, to look at individual behaviour change, to look at patient-centred care, to look at how we interact individually with us and our patients. But this is really standing back and saying, as a profession, how are we really influencing global public health? And so many times, particularly in our country, we focus on individual behaviour change. We focus on issues of obesity, of cardiac disease, of diabetes, of lack of exercise, and all of those are of course important, but global public health takes a different view, and I think it challenges us as nurses to think about the much broader aspects of how we can really influence as nurses. And the exciting thing for nursing as a profession and going forward for me is that we can influence at that individual level, but also at the global level. And there's been some really exciting changes happened in the last few years in terms of global nursing. And that's something that we should be really proud of and think of how we can further. But public health is much more than about individual behaviour change. It's really focusing on populations and not individuals, looking at population change and how we can impact on different populations. Public health is very much a collective rather than an individual activity. It's about working together and how we can work with our colleagues in other professions, interdisciplinary learning. And also it is part science. Absolutely, it is about epidemiology, it is about the changing of diseases, and we've seen this so clearly with COVID-19, coronavirus, how it has swept across the world, but also how it's impacted on different people in different ways. But it is also an art, and that is that there is no boundary between medicine, art, religion, and philosophy when it comes to public health. Because public health is something that is about the science of the disease, but about how we change our behaviour, how it impacts on groups or individuals changes over time. So some of the things to think about are what are the public health priorities in Indonesia? And I've been once to Yogyakarta, and I was there for 2 weeks, and I had a wonderful time. But our health priorities in high-income countries are very different depending on our geography, depending on what is happening in that country. We don't have natural disasters in the UK like you do, and we have many of the priorities in our country are around cardiac disease, diabetes, lack of activity, around stroke and around cancer. But also mental health is increasing, and as we have an increasing elderly population, then the number of people who die from Alzheimer's disease. And certainly in the UK and across Europe, last year for the first time, more people died of Alzheimer's disease and diseases associated with a very elderly population, as did from either cardiac disease or cancers, which were our previous priority areas. So an increasing elderly population and also mental ill health are topics that are really gaining traction and becoming much more important in terms of public health. But regardless of what the issues are, the three areas of public health that are really important are protection, how we protect our population, and this has never been clearer in many ways than with coronavirus, as we try and protect the spread of populations from the disease. In terms of promotion, how we promote health and health improvement. And for so many nurses, that is really part of our role, is around health promotion. And in Europe, we have many health promotion nurses working either in the hospital setting, but particularly in the community. And it's really the priorities that we look as we go forward is towards community and primary health care. And we can really feel a shift in many different contexts away from secondary, high-intensive, expensive hospital care towards primary and community care. And for many countries, the money goes into hospital care. But actually, what I will argue in this session is that really where our priority should be is in the community and in what we call primary care, because that's where the changes come in the long term. So public health as prevention. Public health, we very much look at preventing the disease, and much of the rhetoric around public health is around looking upstream. Now, can be quite difficult to understand, but looking upstream, so not here at the mouth of the river or where the river comes into the sea, but way upstream in the mountains where the river source is. And what does it mean by upstream? Well, the analogy that is often used is this idea of dead fish. And this analogy relates to the work that we often do in healthcare, is that we put, as countries, we put all of our resources into hospital care. We put it into surgery, to treatment, to caring for people who are very ill or dying. And we have expensive surgery, high technology that is very expensive in hospital. And the analogy is that we are all, as healthcare professionals, working down here. We find that we're working here with lots of dead fish, and we're trying hard to cure and to treat those dead fish. But are we really standing back from that and saying, actually, what we should be doing is looking upstream to where there's a factory that is pouring chemicals into the river that is killing the fish? And that analogy is used in public health all the time, that what we should be doing is looking up here. Is there a factory? What is happening in the community? What is happening in the local areas that means that people are ending up in hospitals? And so the whole premise of public health is prevention. Now, prevention works at 3 different levels. But in terms of definitions of public health, way back in the 1980s, Michael Atkinson, who was one of the ministers for health in the UK, said public health is both the science and art of preventing disease, prolonging health through the organised efforts of society, and prevention has been at the key. But the difficulty in the UK and in many countries is that money doesn't go into prevention, and effort often in terms of nursing or medical care doesn't go into prevention. It is sucked into hospital care that is expensive and that is highly intensive. And as nurses, we can also be part of that. For part of my career, I worked in cardiothoracic intensive care. It's exciting. It's a really great place to work. But actually, for the amount of money that it costs for one cardiothoracic cardiac bypass surgery, the question is, what could we do with that money in terms of reallocation of resources into prevention? And so over the years, we can see that there is this tension between hospital care and preventative care. But over the years, I've really moved to believe in preventative care and the value of public health. Public health is the combination of science, practical skills and beliefs that is directed to the maintenance and improvement of health of all people through collective or social action. And it was lovely to hear the end of your last speaker looking at advocacy and the role of nurses in advocacy. And I'm really excited that we're having conferences about advocacy, because several years ago, nurses were never part of conversations around politics, around advocacy, of how we can shape the agenda. But public health is also a belief. It's believing that prevention is much more effective than cure and treatment, because the use of resources, if we look upstream, is so much better to prevent disease happening than it is to treat it downstream. So there's 3 different levels of intervention. One is primary prevention. This is very much preventative in nature. It's completely preventative. So it recognizes the determinants of health to prevent disease. So a vaccine is completely preventative. It stops the disease or virus happening. Secondary prevention is early detection, often healthy or asymptomatic groups. So screening for breast cancer or bowel cancer, or doing blood pressure checks for stroke, checking cholesterol levels. So it's actually early detection. And the third thing is tertiary prevention. So that's to help to reduce the impact of disease. That isn't actually prevention, but it's the early treatment for something, for example, like stroke. But regardless, it's about preventing, so that if we invest in immunization, in screening, in early intervention, then it saves a lot of money and time further down the line. Now, public health is a challenge because it's very hard to prove what you prevent. It's very hard to prove what we prevent, and much of health is based on economics. Drug companies want us to actually invest in hospitals. Many countries want new and shiny hospitals, but the core essence of public health is investing in communities, it's investing in primary care, and it's investing, I will argue, in nursing care, high quality nursing care in communities to really work at that level of prevention. So global public health, what do we mean by global public health? So there are different issues. There are no definitions, no key definitions, but common features. One, we know that disease transcends national boundaries. And of course, we've seen this with coronavirus, but we see it with many other diseases as well. It's not bound by national boundaries. Global public health is based on these principles of public health, which is prevention and intervention at primary healthcare level, but globally. It's very much about partnership working between countries, and it is the result of globalization. And it isn't only services and goods that are globalized, but people. Of course, nurses travel around the world for education and for work. We can go back way to the 1970s. When we look at the World Health Organization, none of these ideas are new, but the question is why do we continue to pour money into hospital care when we've, for many decades, for 50 years, we've known that it is about primary care. So at the Declaration of Alma-Ata way back in the 1970s, the World Health Organization that recognized that health is not merely the absence of disease and that health is a fundamental human right. But the idea that health is a human right is not universal. And we're going to think about universal health care, which is a key priority in order to establish global public health. So the attainment of the highest possible level of health is a most important worldwide social goal. And that is really key. In 1978, it was recognized as a social goal. And yet, I'd argue that when we look at the Millennium Development Goals, it's not till we come to the Sustainable Development Goals that it really is a social goal. We have still looked at health as the absence of disease rather than a social goal for the good of society, whose realization requires the action of many other social and economic sectors in addition to the health sector. So in the 1980s, the World Health Organization, with the Ottawa Charter, stated that in order for us to really improve health, we have to look beyond the individual. We have to look beyond individual disease and individual person. And the Ottawa Charter set out the social determinants of health. And those are that we need peace and stability, we need shelter, We need good education for boys and for girls. That we need food and food security. We need an adequate level of income in order to live, a stable ecosystem, sustainable resources, and social justice so that healthcare is available to rich and poor. But those were set in place 40 years ago. And yet we can still argue that when we look at the Millennium Development Goals that were set in the year 2000, we still didn't quite have it right because we were still looking at health in terms of the absence of disease. So why does global health matter? We see that diseases don't respect boundaries. There is, I believe, an ethical dimension to health and well-being of other people. It's not just about looking after our own health, but it is about the responsibility that we have, and particularly for those of us in high-income countries towards those who live in middle or low-income countries. Health is closely linked to economic and social development in an increasing changing world, and we can't separate those, and we have often tried to. But what's really encouraging about the Sustainable Development Goals is that those have been brought together. Health and well-being of people everywhere has important implications for global security and for freedom. And oops, let me just go back. And if you are really interested in global health, then the World Health Organization Global Health Observatory is the place to go. They have amazing interactive maps that you can really look at global public health and in different country and priorities in different country. So what are ongoing concerns in global public health in 2020? Well, of course, the COVID pandemic has overshadowed most of the other global public health goals, but it's not only this. We still have Ebola in the Democratic Republic of Congo. It's highly complex. It comes and goes. We've had it in 2019 and 2020. It's unclear whether there's still existing Ebola, but that has huge impact on public health and in security as well. We have the rise of chronic non-communicable diseases. It wasn't until 2011 that there was the first high-level summit on non-communicable diseases by the United Nations. And it was really previously before that understood that non-communicable diseases, diabetes, cardiac disease, cancers really impacted on high-income countries, but not middle and low-income countries where the focus was very much on communicable diseases such as malaria, HIV and tuberculosis. But the double burden of disease across middle and low-income countries is highly recognised. Antimicrobial resistance to antibiotics is a real and live issue. We have war crisis and childhood obesity continues to rise. But we have had huge successes. We managed to eradicate smallpox in 1967. It was eradicated by a systematic introduction of vaccination, and it was last case was seen in 1977 in Somalia. We will be able to eradicate coronavirus, but we need to be vigilant around these. So how do we know what's going on? The World Health Organization statistics every year publicizes a summary of World Health data. And whatever country we're working in, this is an amazing source of information to see. And each year this database gets better and gets much more in depth around the World Health statistics. The better statistics that we can capture, the better we can at tackling global public health. So we have seen great declines. In the 1990s, those were bad years. There were declines in life expectancy, especially in Africa due to the HIV and AIDS epidemic, and in Eastern Europe following the collapse of the Soviet Union. But life expectancy has increased in the last 20 years, and the last 5 years has seen the highest increase. The greatest increase has been in the African region, and particularly we've seen increases in child survival, malaria, control and access to antiretroviral treatment for HIV. But we know that many women die due to complications of pregnancy and childbirth. Almost 6 million children die before their 5th birthday. We have newly infected cases of HIV, although people are not dying because of antiretroviral treatment, then the cases continue to spread. TB and malaria. Of course, we have increase in neglected tropical diseases, and more than 10 million people die before the age of 70 due to cardiovascular disease and cancer. And this is all before we add on to the deaths from coronavirus over the last year. But it's not only from communicable and non-communicable diseases. There's increasing concern around mental health. 800,000 people commit suicide every year. 4.3 million people die from air pollution by cooking fuels, outdoor pollution, and murders. 80% of those are men. But we know that the risk factors contributing to disease are smoking tobacco, which is particularly high in some parts of Indonesia, of course, by malnutrition, and then by childhood obesity, drinking contaminated water, and polluting fuels. But global health can't be separated from globalization. We live in a highly globalized and complex world that is an interaction of health economics, of politics, of policies, and of ill health. And so when we bring those together, we have to hold on to our values of prevention, of primary health care, and the role of the nurse within that. So in the year 2000, the United Nations came together with the World Health Organization with 8 Millennium Development Goal and 15 targets. Now, those all did relate to health in some way or another, but we can see that child health, maternal health, and AIDS, those were the 3 areas that in those 15 years were really successes. We reduced globally child deaths by 50%. It was a real triumph. We reduced maternal health, and people didn't die of HIV/AIDS because of antiretroviral treatments. And yet it was very narrow. We can see there's nothing about non-communicable diseases in the Millennium Development Goals at all. And so there were big critiques of the Millennium Development Goals, that overall they masked huge differences within and between countries. They were a very narrow set of disease-specific health targets. So even though way back in the 1970s, the Declaration of Alma-Ata had said how much that we needed to focus on the social side of health, still this was very disease-specific around malaria and HIV and tuberculosis. There was no mention of non-communicable diseases and little consideration of the wider issues. And so we're really encouraged by the Sustainable Development Goals. Now 17 much wider goals, and these ones reducing inequalities, looking at jobs and economic growth, protecting the planet, the ecology. And our question as nurses is how we contribute to this. So those global priorities are reducing global health inequalities, communicable disease, non-communicable disease, antibiotic resistance, foodborne disease, and environmental change and health. And a really interesting report, if you're interested in public health, is to read the report by the previous Director General for the World Health Organization, with Dr. Margaret Chan. And this report is really instructive on where we've come globally in public health for the last 10 years, before Dr. Tedros came in post, and the year of the nurse. And I'm going to really talk about that to really encourage us all around that. One of the key aspects of this report is that we should focus and prioritise primary health care so that we can achieve universal coverage, and this should be the affordable dream. There's no point that we focus globally on expensive hospital care that requires either out-of-pocket expenses or high insurance costs, but actually we don't focus on primary care. We need to change our focus and invest in high-quality nursing in primary care so that we can really influence universal coverage and it becomes the affordable dream. In many countries, if we as nurses work in hospital, it is seen as the highest quality nursing, that nurses are working to the top of our license in hospitals, but somehow that working in primary care is seen as substandard. It's not seen as good quality care. Certainly not in terms of city hospitals. And that is one of the areas that we really need to change. We need to make sure that our nursing workforce work in primary care and that we're working to the top of our license in primary care. And that means that we work as advanced nurse practitioners, but we're not working in hospitals, we're working in primary care. Before I came into academia and research, I worked as an advanced nurse practitioner in primary care. In a community care, I worked as a community advanced nurse practitioner for migrant populations, refugees and asylum seekers. And I think that it is really encouraging that we now see investment in high quality nursing in community care, because that is where we can really make the most change by working in terms of prevention and at community level, so that we can be prescribers, not only writing the prescription for the doctors, but that we are independent prescribers, diagnosing, treating, working as advanced nurse practitioners and prescribers in community settings. And certainly in the UK, our biggest growth in nursing is around developing advanced nurse practitioners for hospital, but also for community care, so that we're working at the top of our license in communities, not only in hospitals. And that's really where we can make a difference as nurses. So going forward, we need a renewed focus, I argue, on primary health care. We need to go back to basics. There is an emergence of HIV, tuberculosis and malaria, to move forward on that. We need to look at those populations that are most disadvantaged. So look at the social determinants of health as nurses and act on those. And recognise the value of community participation, particularly in relation to primary care. And one of the great ways that things are changing and that we feel so encouraged in terms of global health and nursing is the changing role of the nurse. Now, it was amazing that 2020 was the World Health Organization Year of the Nurse, and part of this was through the Nursing Now campaign. This has been a global campaign that I know you've been involved with in Indonesia, but Nursing Now was set up 3 years ago. It was a 3-year global campaign that is now coming to an end, and at Edinburgh University we're part of the evaluation of this global campaign, and it has been my absolute privilege and pleasure to interview many nurse leaders around the world, including at the ICN, at the World Health Organization, and in different countries, about the role of nurses and the way that that is changing throughout the world and what that means for healthcare. The Nursing Now campaign was funded by the Burdett Trust, and it was based on a report called the Triple Impact. The aims were that by this year, 2020, and of course nobody knew that coronavirus would be with us, that we would have really been able to influence universal health coverage, non-communicable diseases and other policy. The aim was to get nurses at the policy table, part of advocacy, because so often as nurses, we're not part of the really powerful change makers sitting at those top tables to influence change. promote and develop nurse leaders. And many of you might have been involved in the Nightingale Challenge, where we've been 30,000 young nurses from around the world developed as nurse leaders. Disseminate and share effective practice, create, identify and disseminate evidence of impact, which is what we're doing just now, and invest in all aspects of nursing. And the triple impact report was that actually nursing has a triple impact that hasn't been recognised before, because to have more nurses means that there's greater gender equality, because we know that most nurses are women. It builds stronger economies and better health. And if you haven't read this report, I would recommend that you do. At that time, more than half the world's population lacked access to essential healthcare services. Almost 100 million people were pushed into extreme poverty every year because of having to pay out-of-pocket costs, and that the world was facing a shortfall of 18 million health workers to sustain universal health coverage by 2013. And more than half that shortfall is nurses and midwives. We make up 70% of the global health workforce, and yet we don't have the recognition or the status that we should in terms of that, and we need to change this. In 2013, particularly low-income countries had only 0.5 per 1,000 of the population nurses, compared to high-income countries of 6.5 per 1,000, and that needs to change. So the Nursing Now campaign has worked on universal health coverage, evidence of impact, leadership and development, working within the Sustainable Development Goals and sharing effective practice. So 2020 was endorsed as the year of the nurse and midwife, and what a year. Coronavirus has also worked with us as nurses, because it's really shone the light on the importance of the nursing workforce in a way that never has before. And Dr. Tedros has championed us as a profession. And this really fantastic report was published this year, The State of the World's Nursing. This is the first global report that has ever been published around the state of the world's nursing. And this is a really exciting report, because it urges world leaders to invest in education, in nursing, and in nurse leadership, because this is how we achieve universal health coverage. We work at prevention, public health, and primary care to really make a difference. And at Edinburgh University, we're currently leading the evaluation of the Nursing Now campaign, and that report will be published next year. And we're really looking forward to seeing how that happens and goes forward. So if you're interested in Nursing Now and you want to find out about it, then I really urge you to look at that. So in conclusion, it is really encouraging to be a nurse at this time. Never before has nursing been in such a spotlight. Nurses can really work at the top of our license to be advanced nurse practitioners, to be advanced researchers, working with the highest level of skills and knowledge and education, but not to throw that into necessarily city universities or city hospitals, but to be working in primary care, in community care, where we really make a difference, improve standards, and that we can really advocate on behalf of our patients. It's been a real pleasure to speak to you today. If you have any questions you would like to ask, please do. And or if you want to contact me, I can put my email in the chat box. Thank you.
Thank you very much, Fiona, for your wonderful presentation. And yeah, actually, it's also what happens in Indonesia now. With the pandemic COVID-19. Actually, the latest report also says that there is a rise of the number of the tuberculosis again. So actually, we are already shifting to battle the non-communicable disease, but because of this pandemic, and then now there is like a really significant rise in TBC. So that's really damaging. And it's not only TBC, actually all the chronic disease also, like now it's in the it's in the rise. So, yeah. So I have several questions here in the chat room. First of all, it's from Dianita. She's from School of Nursing in UMY. She asked about I wonder what is the challenge in the nursing education to shape nurses that be able to collaborate in global health issue context.
So I came to the University of Edinburgh 6 years ago, and I came with a background as an advanced nurse practitioner in public health, working in communities. And I think at that time it would be fair to say that Edinburgh University didn't really have a focus on public health. So part of my remit was to change that focus in terms of education. And I certainly teach now. We have courses at undergraduate level. I teach global public health at undergraduate level and at postgraduate level, and teach about health inequalities, the social determinants of health, from first year undergraduate nurses. Now, they don't want to learn about that. They want to learn about how to give an injection and how to run an intravenous drip. But actually learning about those structural inequalities really does set up students for life. And by the time our students graduate from undergraduate level, there's several students who want to go on and work in primary care, to do masters or PhDs, to become advanced nurse practitioners in primary care. So I think education can make a difference just by changing the focus slightly to include global public health and health inequalities topics as really important subjects to teach, because then the students realise that community is just as important as hospital, and how we design our curricula sends messages to our students about what we think is important in health.
Thank you, Vena. I think that's a really clear answer as well. So I'll continue to the second question. We still have many questions, but I believe you really have really tight times.
Yeah, I've got 5 minutes because
5 minutes, yeah.
I'm teaching another class in Edinburgh at 9.
Yeah. Okay, so I'll just read one more question from the participants. Okay, I need to choose one. I have 5 more here. Okay, this one from Kurnia. It's in a private chat. Would you please explain what are the top 5 priorities of health issues globally and how nurses are able to voice their roles to tackle those issues? So, the 5 top priorities, yeah.
Yeah, the top 5 priorities globally, that's difficult because it very much depends on global health priorities are really divided between high-income countries, middle-income countries, and low-income countries. For high-income countries, those top priorities are cardiac disease, are cancer, are Alzheimer's disease with the elderly, and diabetes. For middle-income countries, then in the global health community, we talk about the double burden of disease, non-communicable and communicable diseases. So if we take away coronavirus, because that has really dominated this year, but if we take away coronavirus, in middle-income countries, it's the double burden of disease. So we have cancer, cardiac disease, diabetes, as well as an increasing elderly population. So not as much Alzheimer's disease as we have in high-income countries, but increasing and mental ill health, but also non-communicable diseases, malaria, tuberculosis, HIV and AIDS, and then tropical diseases. And for low-income countries, particularly sub-Saharan Africa and Southeast Asia, then it is predominantly the communicable diseases. Does that
Okay.
answer your
Yeah,
question?
I think that's answering the question. I have one more question because I think this one is really interesting. So now the pandemic in Indonesia is like in the UK and in European countries, it's already the second wave. But in Indonesia, we are still in the first phase, and then we don't know when it's going to get down. And most people in rural area actually no longer believe in COVID-19, and they think this is just hoax and this is the fake news. So this is the question from Uswatul Hasanah. She asked how, as a nurse in a community service in the public health, how we should deal with the COVID-19 pandemic issue in community with this kind of situation.
Yes, it's very difficult, and in our current world, especially when some leaders are spreading fake news, how we get over those safety messages. I think when we work at community level, then we need to also, that's where I think when we're working at community level, we can feel really disempowered if we don't have a voice at a higher level. And I think what is really important is that as nurses working at community level, that we are also connected in and have a voice with higher level of policymakers, because it's often using by having high profile or famous people who will give out those messages, those positive messages about wearing masks and social distancing, that we can really make a difference. But it's very hard, I agree, when we're working at community level in order to really make a difference if there's different messages at a senior or a national or a Ministry of Health level. And we can't change everything overnight. This is a process. But as we have nurses who are really working and speaking at those highest policy levels, then that can really help to support us, those of us who are working at the community level.
Okay, thank you, Fiona. So actually, that's really related with the presentation from our first speaker, that as a nurse, we should take part in shaping the health policy. We need to speak up on the table. Aisha always said, if you don't have any chair, bring your own chair to the table.
Yeah, absolutely. And I think because, because it's a very gendered profession, nursing, we're majority women, we're not had a political voice so much, and that's really what has to change as we become more skilled, as we become more professionalized.
Okay, thank you very much, Fiona. I think it's only 1 minute, so you can run to your next meeting on time.
Thank you
But
so much.
luckily, actually, all pandemic also bring it's kind of blessing in disguise. We can have you here in Indonesia anytime because of the technology. So thank you very much for taking time with us to give a really wonderful presentation about global public health nursing. I hope you have
lovely to meet with you all.
Yeah, thank you, Fiona.
Okay,
and hope to see you in real soon.
I hope I can come in real life one day.
Yes,
okay.
We are waiting for you here, looking forward to have you here.
Thank you.
Oh,
lovely to meet you all. Bye.
And we can take you to the massage place again. Okay, bye-bye, Fiona. Have a nice day.
Bye, thank you.
Okay, so because Fiona have to run to another meeting, so I hope that the presentation from Fiona is really helpful and useful for us as well to understand the context of the global health now, and then with this pandemic situation. So I think I have some question as well from Budianita. I'm sorry, Budianita, you have to wait because Fiona doesn't have time to wait until the end of our meeting. So we have one question from Moses, Budianita. Moses is from Africa. So he asked about what are the main public health policies that the continent of Africa has to follow to restrict the tobacco consumption.
Oh, okay, sorry. Hello, Moses. Thank you for your patience. I think in the global context, we have been discussing on the WHO Framework Conventions on Tobacco Control that currently is signed by 178 countries who sign and also ratify this treaty. And among these haven't signed the treaty, there are such country that's not involved in the signings. It is about 16 of country that's not yet signed and also ratified the treaty, that it will be weakened on how the tobacco control policy could be implemented in their countries, as the framework conventions on tobacco control already specify what country needs to do to eliminate and to protect their populations from the tobacco effects, including how the advertisement, promotions, and sponsorship ban could be implied in each country. So in the global context, FCTC from WHO is the main policy that all the countries should be following with. Thank you.
Okay, Moses, I think, is that already answer your question? We still have a bit more time if you want to clarify some more question to Budianita, or if anyone else still have something to ask Budianita, because I think the issue of, like, as Fiona also mentioned, that nurses actually, it's a really crucial part of in shaping health policy. So we as a nurse should take an active approach in terms of policy making, because if we are not, like, start the game where we're just be left behind. So we need to be really active in approach the government and stuff to do the health policy thing. Like this, Budianita, I forgot to introduce, is Vice Director of Muhammadiyah Tobacco Control Center in UMY. So she actually already has a lots of experience in terms of health advocacy and policy with many levels in national, international, and also in local. She did several advocacies with the ministries, Ministry of Health, ministries of what else, Budianita? Is like this morning Kemenko PMK. I don't know what is the English, ya. Kementerian Koordinasi PMK, Perekonomian, yeah. And then also the Ministry of Finance to push the government to increase the excise tax, because maybe some of you already read the news that the government finally issued or increase the excise tax, although it's not as high as we expected, but at least there is a bit of increase. And also that, so we as a nurse actually also can take part of that kind of decision. So is there anyone here who still want to ask something to Budianita, maybe related to tobacco control in Indonesia or anything? You can raise your hands while we still have time.
Is enough?
Is it enough? Okay.
Yes.
I think it's enough. So thank you very much, everyone, for coming to today's meeting. Yeah, and also I would like to thanks for Dr. Rosnani Sarkarsi as well from AUM from Malaysia. Thank you for attending our event this evening, this afternoon. It's not evening yet. Yeah. Thank you very much, and send our greetings to all the colleagues in IIUM. And also for all the master student, and also from all the participants from other university that are spending this afternoon with us. So I hope that we can see each other again next time in a better situation, the better condition. Hopefully also the pandemic is over, yeah. So we can have a face-to-face meeting maybe next time, or something like that. So thank you very much, everyone. So let's close this meeting today. Me as the moderator, apologies if I am during leading the discussion making lots of mistakes. And stay healthy, stay safe, and also keep the 3M, yeah. Masker, cuci tangan, and social distancing. See you next time. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Bu Dianita. Thank you, Bu Tantri.
Sama-sama,
Thank you,
Pak
Madam.
Guru.
Everyone, thank you,
Thank you for
Budianita.
all.
Thank you, Madam.
Thank you.
Mulai.
Iya kok, kadang-kadang orang. Jadi, Kokot jagain Dudung kan.